Hello everyone, welcome to sqadia.com. I'm Dr. Hamna Iftikhar and today's lecture regarding gastroenterology is about Helicobacter pylori infection. This Helicobacter pylori infection is the most common chronic infection in the world. This unique bacteria has special qualities that it can reside in the gastric lumen, which is very acidic. This bacteria also has a very unique structure. It is a spiral-shaped bacteria with multiple flagella that help the bacteria to move around the gastric lumen freely and to penetrate through the gastric lumen and the gastric mucosal layer. This bacteria also produces a enzyme known as urease, which helps in hydrolyzing the urea into ammonia and carbon dioxide, which helps lowering the pH of the which helps neutralizing the pH of the gastric lumen. So in this lecture, we'd be dividing the topic into three sections. The first section will be regarding the pathogenesis of the H. pylori, starting with the epidemiology, and then coming to the pathogenesis, which consists of bacterial colonization and different type of virulence factors. Then the second thing we'd be studying about is the response of the host in regard to this H. pylori infection. And lastly, we'll be studying about the conditions that arise from this H. pylori infection. The second section, we'll be studying about the diagnosis. How are we going to diagnose a patient with H. pylori infection? What are the indications that are given to the patients with H. pylori infection, and what are the indications that they should be tested with to diagnose this infection? The second is that we'd be studying about the non-endoscopic, the test that does not involve any sort of endoscope that has been passed through the esophagus. And then there are tests that consist of the use of an endoscope. Lastly, in the third section, we'll be studying about the different treatment modalities that are being offered to patients with H. pylori infection. What are the primary treatment regimens, what are the secondary treatment regimens, and what are the rescue therapies that can be offered to patients regarding H. pylori infection, and what do we do with patients who come up with resistance and recurrence and reinfection of H. pylori infection. We'll be studying all these topics in this lecture. Keep watching sqadia.com.